Treatments to decrease dynamic hyperinflation. What is dynamic hyperinflation? This is when the patient starts their next breath before the lungs have emptied from the previous breath. The concept of decreasing dynamic hyperinflation of the rib cage is based on the assumption that this intervention will decrease the elastic work of breathing and allow the inspiratory muscles to work over a more advantageous part of the length-tension relationship. You may be surprised to see relaxation as a physiotherapy treatment. However, it is used particularly in patients with chronic cardiorespiratory disease. Relaxation is a state of being free from tension and anxiety. The theory for relaxation in these patients is that slowing down the respiratory rate will allow more time for expiration. Relaxation can take in any form. This can be mindfulness, progressive muscle relaxation, visualization, or yoga breathing. Visualization or yoga breathing. These sessions can take place as part of pulmonary rehabilitation. One of the methods I used in pulmonary rehabilitation was something called the Laura Mitchell technique, and we'll cover this later on. General tips for your patients would be to choose a quiet and comfortable place away from distractions. Wear loose and comfortable clothes. Sit in a chair or upright in a bed supported by pillows. This would depend on the level of respiratory disease and how upward or how flat they could lie. Before they start, if appropriate, they should clear their chest of any secretions. Thinking about starting relaxation at a convenient time after using their inhaler. They should avoid relaxation shortly after eating, and they should do it in a room which is of a comfortable temperature, so not too hot or too cold. Relaxation may feel like a struggle at first, however, not too hot or too cold. Relaxation may feel like a struggle at first, however, it becomes more natural as the patient progresses with it. One of the key aims of relaxation is to help the patient better cope with their respiratory disease and to help to manage their anxiety. With the Laura Mitchell technique, the sequence for each part of your body is to move your body away from the position of stress, stop the movement, and then take a moment to feel and be aware of the new relaxed position. Get into a nice comfortable position. Breathe gently through your nose, keeping your upper chest relaxed. Each time you breathe out, allow your body to relax a little more. Take time to check your breathing after every movement to ensure you're maintaining a gentle pattern and not holding your breath. We will now begin the Laura Mitchell technique. Pull your shoulders down towards your feet. Stop and feel the new position. And breathe. Slide your elbows away from your body. Stop and feel the new position. And breathe. Stretch your fingers and thumb out. Stop. Feel the new position. And breathe. Hips. Turn your hips outwards, rolling your knees away from each other. Stop. Feel the new position. Push your feet away from your head, pointing your toes gently. Stop and feel the new position. And breathe. Push your body into the bed or chair along with the length of your spine. Stop and feel the new position. And breathe. Push your head back into the pillow or the bed or the chair. Stop, feel the new position, and breathe. With your lips closed, stretch your lower jaw down as if you were yawning. Stop and feel the new position. Ensure your tongue is not pushed up into the roof of your mouth, but is resting in the lower part of your jaw. and breathe. Raise your eyebrows towards your hairline. Stop. Feel the new position and breathe. The evidence for relaxation in patients with COPD is weak. However, it is strongly endorsed by the patient representatives and is commonly used as part of COPD. There is a need for further research to be done in this group. As we touched on in the signs and symptoms of increased worker breathing, some patients with chronic respiratory problems will naturally use pursed lip breathing, while others will not. The theory for pursed lip breathing is that breathing out through a slightly open mouth creates positive pressure within the airways. This positive pressure helps to split the airways open, therefore decreasing the airway resistance. This makes it easier for your patient to breathe. It can be done in conjunction with other treatments, so positioning or breathing control. At rest, using pursed lip breathing has been shown to reduce respiratory rate. At rest, using pursed lip breathing has been shown to reduce respiratory rate, decrease hyperinflation, help dyspnea, improve tidal volume, and improve oxygen saturations. Your instructions to your patient will be to breathe in gently through your nose and then purse your lips as if you're going to blow out a candle. Blow out with your lips in this pursed position. Imagine blowing out a candle when you breathe out. Blow out only for as long as you are comfortable and don't force your lungs to empty. It should look something like this. Evidence supports the use of pursed lip breathing during exertion as a strategy to help patients with COPD to reduce their respiratory rate and aid their recovery.